The FDA Tuesday approved Pfizer's COVID booster shots for kids 5 to 11.
We are overall very happy.
Dr. Daniel Summers is a pediatrician. With this news, his practice will now have to make a booster plan.
6 months after the second dose, and so for our patients, that's going to be June. So we have a little bit of breathing room to come up with a plan.
Okay.
Kids over 5 became eligible for the vaccine in October, so some are in range for a booster. But nationwide, less than a third of kids 5 to 11 have received the first 2 doses of Pfizer's vaccine.
Definitely still have many families where the parents haven't felt comfortable.
I have not made up my mind whether I'll get the kids vaccinated.
In Oregon, 40% of kids 5 to 11 have had 1 shot, and the state's vaccine dashboard says very few are in the time range needing to get a booster yet. Meanwhile, some parents of younger children are still waiting. Moderna requested the FDA approve its vaccine for toddlers and babies under 5. It would take 2 shots, 4 weeks apart, and be a quarter of the adult dose. Moderna says it is 51% effective for kids 6 months to 2 years and 37% for ages 2 through 5. Despite kids generally being less vulnerable to severe COVID, as cases grow,
some protection is better than zero.
Doctors say child vaccines can only help the community.
We've had to be very careful with him.
Stephanie Loring has a 3-year-old who's immunocompromised, and she's anxious to get him vaccinated.
I really hope the FDA really pushes this through and has some urgency. We're so ready to re-enter the world.
I address whatever concerns they have.
Dr. Summers says he doesn't try to convince hesitant parents, but rather be a resource of real information through all the noise online.
And what is your overall takeaway and hope for the future?
I would hope that we can recognize that medical information isn't political. When you have basically the entire healthcare profession saying this is a good thing for you to do to keep yourself healthy, that we're doing it because it's really what you need to do to keep yourself healthy and there isn't any other agenda.
Now, this FDA approval now heads to the CDC, which is scheduled to discuss child boosters on Thursday and make a final recommendation then. Shots could even begin as early as Friday. Brittany?
All right, important update. Thanks so much, Galen.